Thank you, Sue. Yes, so just as you said, this is my light, this is my candle, everybody, burning bright in the background. I've got two. So this one is for all the families that I care for and the babies that are really, really missed. And this one here, you can't really see, but it's a pink rose quartz, pink for a girl, pink for my daughter Jada. And so I have two, and anybody who knows about rose quartz knows that it's the crystal of love. And you'll feel, I think you'll feel it from me, and you'll definitely hear it in my story. It's so important for me that anytime I talk about Jada, anybody that talks about her, anybody that thinks about her, I want that to be with love. I want it to be led with love, and to be her memory being left with love as well. So that's why I have rose quartz. It's my favorite color as well. So yes, as Sue said, my name's Lauren. Thank you, Sue, for inviting me to talk to you all this evening, to everybody around the world, because I know we have listeners everywhere. I am a bereavement midwife, but I am first a bereaved mum, and I'll tell you a little bit about my story. So I have had two daughters, Mia, who is 19 years old and has left me to go to university, and then Jada. And Jada was my second child. I had a low risk pregnancy. I didn't think anything was going to go wrong. I kind of just went through the motions, took all the advice that I was given. I was really, really excited about having her. I had made plans, I guess, for my delivery because I'd had an emergency section with Mia, and I didn't really want to go through that again. It was horrible. Um, but I wanted to try for natural labour. I did that. And then we got to the end, and I just said, I really don't want to be induced. It didn't end well the last time. I just want to feel like I've got a bit more control this time. And so I wanted to have an elective section, which was booked in for 41 weeks. So the day before, I was having my pre-op assessment at midday, 2 o'clock midday it was. And Mia had said to me, Mum, please don't have my sister until I've had my Easter assembly. And so the Easter assembly was the priority. I went along, I did my bit. I knew I had to then go home, get all the sheets washed, pack my bag, go off for my appointment because I knew the next day I was going in for the section. And in the Easter assembly, my contractions started. And I thought, oh, this is pretty bad timing, but this assembly is nearly finished. I can get through this, and then I can get off to the hospital. But then the contractions kind of kept coming, and I'd obviously been in labour with Mia, and I knew that it didn't really feel right. They were coming quite often, not lasting for very long, but I just knew something inside me said something isn't right. I called my sister, and she said, I think you should just go to the hospital early. I know your appointment's in the afternoon, but just go now. I said, yeah. I just need to quickly go home. I just need to go and get a few bits, drop some things off. I'm running errands. So I'm thinking, if I do have to stay in, I need to have done other things, which is typical of mums to think that and do that. And I'm not thinking that anything's seriously wrong because I'd felt her moving that morning. And so I went off, did what I needed to do, got to the hospital about an hour later, went into triage, and I said, my contractions have started, but I'm due to have a section tomorrow. So I'm just coming to make sure that everything's okay because I'm not sure that contractions feel right. So the first sonic aid, and we can't find the fetal heart. Second sonic aid, sorry, I might sometimes say baby, sometimes fetal. It's the midwife in me. Couldn't find her heartbeat. The second sonic aid, and it was the same thing. And at that point, I just thought, okay, I'm 41 weeks. If there is something wrong, let's just do something quickly, get me upstairs to theatre, let's do the section, let's not waste any time. And I felt like we were wasting time in that moment because they weren't able to find her heartbeat, but we weren't really going anywhere. And then the doctor came in and said, we need to do a scan. And as a midwife, I now know it can be positional. It might be that she was in a funny position and we couldn't find the heartbeat. I didn't know that at the time. I wasn't a midwife at the time. So we went up to the second floor, and it felt like literally 5 seconds. The sonographer put the scanner onto me and immediately said, I'm really sorry, your baby's died. And in my head, I thought, how can you tell that quickly? How can it take you 5 seconds to tell me that? And it was a real delayed reaction. I felt like my body was in the room, but my mind was still looking out of the window thinking something must be okay to fix kind of thing. And then I was on my own at the time, and I called my mum because she was literally around the corner, and she came. And I said, I really, really don't want to give birth. I said I wanted to have a section. I still want to have a section. And they said to me, well, we wouldn't advise it. You know, as we do, we're talking about risk of surgery. And they did say, you know, the scar is going to be a reminder to you. And in that moment, I thought, first of all, I've already got a scar from Mia, so that doesn't make any difference to me. And secondly, my baby has just died at 41 weeks. I don't need this. I'm not going to need a scar to remind me of that every day. Trust me, I'm going to be remembering this. And that felt quite almost patronizing and not really understanding of the situation. And so we spoke it through, and I said, okay, you know, they were really, really trying to not convince, I don't want to use the word convince, but to go through all the risks with me. And it did make sense to have a vaginal birth. I wouldn't have had to have the prolonged hospital stay. There were the risk of surgery, having to have a catheter, all those other things that come along with it. And in that moment, I was thinking about Mia and then wanting to get home to her as quickly as possible. So because I was already labouring, I went up to the labour ward, and we tried to do an epidural. I've got really, really bad discs in my back. And so it took 5 attempts to get the epidural in, and literally 5, that isn't an exaggeration. I then had some Syntocin on, I went into labour. And it's really important when I'm teaching this, whenever I'm teaching a bereavement session, I'm always teaching from the parent's perspective. I'm telling my story as a parent, and then I'm saying to the midwife, and in this moment as a midwife, this is what you can do. This is what you should be doing according to guidance. This is what you can do to help a mum. And in that moment, I really felt like I was flitting in between moments of thinking, I'm in labour and I'm having a baby, because I was contracting and I could feel it. And I thought, I know what this is. This is labour. And then there's be this kind of stark slap in the face that felt like, actually, no, because they're not monitoring her. And in that moment, you just remember that actually she's died. And that was really, really hard. And that confusion, I think, lasted for weeks, which I'll get to later down the line. And so I laboured overnight. And then it came to the point of second stage, and I was about to start pushing. And I said to the midwife, I really, really don't want any doctors in the room. I want it to just be me, her dad, and the midwife. I wanted it to be quiet and calm. I didn't want to have anybody extra in the room. I didn't want to have the bright lights. I didn't want to have any intervention. I just felt like if this is going to happen now, it has to happen my way. And I was really, really scared. And midwives will often say to me, you know, in that second stage, how do you communicate with the woman? When we have a live birth, it's quite animated and it's excited, and it can be calm and lovely and peaceful as well. But often it's like, come on, you're there, you're doing it, keep going, keep going. And actually, what I say to them is, it's the same vocabulary, it's just said in a different way. Come on, Lauren, you're nearly there, keep going. I can see your baby's head, you're doing really, really well. You're saying the same words, but you're saying it in a calmer, just calmer kind of way. So you're still motivating somebody. And that was really important, because in that moment, I lost motivation. I remember being on all fours over the back of the bed. And I just stopped and I said, I can't do this. I can't do this knowing what's about to happen. I feel like I'm going to go through all this and all this pain pushing for what end, and for what, I don't have any prides at the end of it. I just don't want to do this anymore. And I gave up. And my midwife was amazing. I actually work with her now. I work with all the people that looked after me. And she said to me, you can do this, but I have to tell you that if we don't carry on and we don't progress, I am going to have to call the doctors in, which she was right to say, because that is the situation. But I think she also knew that that was what I didn't want to hear, and what I needed to hear to make me kind of get back in the room and get focused, which I did. And then I continued to push, and Jada was born. And I really feel like in that moment I wasn't prepared. And I don't know if any parent really can be prepared, because I was on the bed, and anybody that's given birth will know that when you've given birth, you're like, oh, I'm done, I'm spent. But I literally scrambled to the top of the bed. I don't know where that came from. It was all adrenaline, but I was so scared by what I saw, because she was big baby. She was over 3 kg, 8 pounds something, really, really big, chunky thighs, biggest thighs I've ever seen on a baby. But she just wasn't moving and she was silent. And it was shocking to me. It was shocking. And I'd already had the conversations with the midwife about, do I want to hold her? Do I want to see her? Yes, I want to do all those things. And she looked at me and she said, your baby is beautiful and she is your baby and she's always going to be your baby. And I said, yeah, give me my baby. And from that moment, I held her for literally 10 hours. We stayed in the room together. She was lying in the bed next to me. And it was really kind of an out of body experience almost. There were moments when, and I'm sorry this is upsetting to anybody, there was a moment when the little trickle of blood just came down her nose. And instead of it shocking me, it was almost like I saw it as if it was just snot. And I just said to her dad, oh, babe, just wipe that away. And in anybody else, they would find that quite shocking. But the level of confusion that I was in, I didn't see it as blood. I can't explain it any other way. And so she stayed with me in the room, and we only had 2 pictures, which now is completely different. There's an amazing charity called Remember My Baby, which is in most maternity hospitals in the UK. And they take remembrance photography of babies, which is just amazing. If you have a chance, please look at their website. I didn't have that opportunity. Was given 2 pictures of her, which were taken 10 hours later. And she was very puffy, quite purple, and her lips had changed colour by that time. And she'd kind of got into that usual, babies will kind of, their face will open up and they'll be looking like that, which isn't the way that I remembered her. I do have 2 other pictures that I instinctively took when she was born. And I'm so grateful that I did that in that moment, because otherwise I wouldn't have had any memory of her in that moment. She stayed with me in the bed. The doctors came in, which at the time wasn't great. And they were talking about postmortems. And I think the way it was done wasn't really optimal for me in terms of my experience. I agreed to have a full postmortem. That's what I wanted to have for her, because this has come out of nowhere. And I thought, I really need to know why this has happened. So we did a full postmortem. I went home. I went off to my sister's house for a few days because I just needed to feel like I needed to get away. I was coming back to my house that had her cot, everything, her room was completely done. And I just thought, I don't know if I can live in that. I came back home, I packed a bag and I went off to Cambridge to my sister's. And the next day I got a call from the community midwife saying, oh, yeah, I need to come and check you and your baby. And I just thought, I had a baby? Like, where is my baby? That confusion came straight back in again. And then she said, oh, no, I'm sorry. I need to come and check you. And I said, okay. And again, it's these moments of just these daggers in the heart that you feel, the aftermath of it all. We went home and I had, which a lot of parents do experience of, not everybody finds out that this has happened to us. You're walking in and you go into Tesco's and you see somebody that doesn't know and they're like, oh gosh, where's your baby? And you're in that moment, it's really, really difficult because you don't really want to put that burden onto somebody else. I was so conscious of feeling like I don't want to give my sadness to anybody else. I felt so responsible for other people's feelings. And it's something that I say to the parents that I look after now, please be kind to yourself and talk about it if you want to talk about it. And if in that moment you don't want to, you just say, I just don't want to talk about it right now. But I always felt like I couldn't say that. I felt like I had to give them an answer, and the answer I didn't have. So we fast forward to where I was meeting with the consultant to talk about the results of the postmortem. And up to that point when I walked in the door, I needed to know an answer. And she knew that I needed to know. And I walked in and it was an inconclusive result. And they'd done every single test you could imagine on me to try and find out a reason. And in that moment, I remember I literally sat back in the chair and I just said, that's actually the best thing you could have told me. And I've only just realized it in this moment, because if you'd said, there was a problem with her heart and we missed it on a scan, or there was something that I missed or the midwife missed, I would be having to live with anger and wanting to blame somebody. And I didn't want to have that heaviness. And I only realized that in that moment that actually I can now live having only memories of love for her rather than memories of anger and upset and blame. And I think that would have eaten me up. I had counselling with a private counsellor at the time. She had been volunteering at the hospital. We now have Petals, which is just amazing, an amazing charity founded by Karen Burgess, who I absolutely love. And that counselling is for parents and for midwives, any staff that's involved in bereavement care, if you're in the UK. So I had my counselling sessions, and I felt, you know, I don't want to say coming out the other side because I don't think you do. I think your life just changes. But I realised that not only was I grieving for Jada, I was grieving for the person that I was before I lost her. And it's something that's really underestimated, and something that I urge anybody doing bereavement care to really pay attention to for the parents and supporting them with that. Because I didn't laugh at the same things. I didn't want to have the same conversations. I found those conversations really irrelevant. Whereas the week before, I would have loved talking about a reality show or something like that. And in that moment, I just thought, no, this is not important. And when I spoke to a mum last week, she said exactly the same thing. And we spoke about giving yourself a bit of grace and time to let everything process. And that doesn't happen very quickly. One of the most important things that I tell parents is never to set yourself an expectation of, in 2 years' time, I'll be feeling different. In 2 years' time, I'll be able to have those conversations, because when 2 years comes around and you don't feel like that, it is devastating, because you feel like, again, I've kind of failed, because why aren't I still okay? When really this is the new normal and the new okay. And it really takes time to get your head around it. It's taken me a long time to get my head around that. And so when I was in the hospital, the job I was doing at the time was in elderly care, and I used to monitor standards of care in a nursing home. So I kind of went into work mode, as people do when they're grieving, and I wrote down the list of all the things in maternity throughout my whole journey that I thought were really good and things that I felt could be improved. One of those things was the doctor and the postmortem consent, which I didn't think was great, which we don't have that issue anymore. And the other thing was the room that I was in. It was a typical hospital room. I'm in a hospital bed. Her dad was on the floor on a yoga mat. It was freezing cold. And I just felt like that separation in that time kind of set a precedent for how we would move forward. And it did, because we broke up probably 7 to 8 months after her death. And I really felt like, had we been able to be together, it would have set a path of how we then continued with that. It was also down to the fact that he, as a lot of dads and partners do, they want to be able to fix and protect. It's not a comfortable place to see your partner being that upset. And I think that he struggled with me being upset, but I needed to process it. So I wrote this list and I gave it to the bereavement midwife. And I said, I don't know if you're going to do anything with this, but I just needed to do it for myself. And she came back to me a couple of weeks later and said, I've been looking at your list and I want to talk to you about the room. And I said, okay. And she said, we've been trying to get a bereavement suite. This is back in 2013 when National Bereavement Care Standards didn't exist. And actually bereavement care, there wasn't a lot of bereavement midwives in the country, as many as there are now. And I said, okay. And she said, we just haven't been able to raise the funds to do it, but I acknowledge everything that you've said. And I said, don't worry, I'll get you the money. And then honestly, so I thought, how am I going to get the money to open a suite in a maternity hospital? But I spoke to 2 of the mums at school who'd been there when I'd gone into labour, and they said, we want to help you do it. And so we did a walk of Hadrian's Wall. I lost a few toenails, but we made over £13,000. So that was worth it. And so the year later, in 2014, we opened Jada's room at Queen Charlotte's and Chelsea Hospital. So the same room that I gave birth in was transformed into the bereavement room, called Jada's room. And I never expected them to call it Jada's room. I thought it would be the butterfly room or or something like that. And it was in that moment when I saw her name on the door that I realized now what this journey was about and what her legacy is, and that I have the power to do that for her. She was here, she existed for 41 weeks, and she has the right to be able to make her mark. Sorry, I might get a little bit upset there. And so I realized that I can use this and I can channel my grief in a really positive way, because it would have been devastating to me if her death had not mattered and not meant anything. I needed it to mean something. So we opened the room, and that was when I really got to work with Jacqueline's Uncle Bent. At the time, she was the lead midwife at Imperial. She then, you might have known her, most people listening might know her as the chief midwife of England. She's now the chief midwife of the world, I like to say, at the WHO. But I worked with her quite closely, and she said to me one day, you know, you'd be a really good midwife. And I said, well, it's funny, Jackie, because actually I did want to do it years ago after I had Mia. But, you know, being a young mum, I needed to work. I couldn't really go off to university. And I said, but I really do think I want to do it. And she said, okay. So I did my access course. I went off to King's. I started at King's in 2015. And I walked in and I said, I just want to check when the session is about stillbirth, because I had one 2 years ago. I told them I felt I needed to. And they said, well, don't worry, because it's not until your second year. And I was like, actually, that's a bit of a problem, because I think we need more than one lecture in a second year. And they said, yeah, actually, we think you're right, but we're not really sure how to do this. So I said, well, would it help if we started with me just coming and telling my story to people? Because I think that really is so powerful when people can hear your story. And they said, yeah, okay, let's do that. And then it kind of evolved into what it is now. And I created the training package in my first year. And I said, I've written this package. I don't know what you think of it, but it covers everything from antenatal, intrapartum, postnatal, community, grief, mental health, postmortem, global impact, antenatal diagnosis, and how people manage that in terms of termination for medical reasons. And it's everything. And they said, okay, great. And now we have that still going 10 years later, and we teach in the first, second, and third years. Because yes, the first year is about normality and you're observing, but actually, if you're in a situation where you have a stillbirth or a really traumatic situation, you're being exposed to it, but you're not having the learning and the knowledge and the support in university to be able to help you with that. And I think it's important that students get that. So I'm really, really happy that that's still going, and I love everybody at King's, Jan Bowden and Sam Bassett, for really getting behind me and supporting me with that, and supporting the students because they recognise the need for it. So I finished my qualifying. I stayed at Imperial. I became a bereavement midwife. And then it was a real turning point on my first day in the numbers, as we say, no longer supernumerary. And I walked in and I could see a bereavement case on the board, and I thought, oof. And I didn't get assigned anybody, and I thought, am I going to be doing the resuscitator checks? I mean, what am I going to be doing today? And she said, no, I want you to go and look after women in Jada's room. And I was like, it's my first day in the numbers. She's like, yeah, you're the best person to do it. And I did. And it was like full circle moment for me. I remember standing there looking at the door with her name on the sign and thinking, I was just lost for words. Like, I can't believe I'm in this situation, but I know that I'm meant to be here. I think I bring something to the role, and I'm not one of those people that says you have to experience this to be able to do the job. That's not what I'm saying. But I think that I'm able to recognize in those moments things that I saw in myself. I remember lying there when I first got told the news when I was in labour, just feeling completely lost and really vulnerable. And the bereavement midwife coming in, and I always say that she just kind of scooped me up. Her name is Jane Scott. A lot of people in bereavement will know her. And Jane came in and she scooped me up. And I thought, that's what I want to be for somebody. And I know that I can be that for somebody. And so I'm able to recognize quite quickly when somebody is in that moment. And I had it recently with a woman who just didn't want to talk to me, wanted everything to go through her partner and her mum. But there are some things that we do need to hear from mum. We need to have her consent and hear her opinion and her choice on things. And I don't really talk about my story too much. If I need to, it's only because I'm trying to connect with her to let her know that she can trust me and I understand. And I said to her, I told her what had happened with me. And for 2 days, she hadn't spoken to me. And then she turned around and she said, I'm so grateful that you said that, because I just felt like everybody was coming in saying, we understand. And how can you understand? And so I feel like I'm able to bring something to the role which is really, really truthful and authentic in that moment with that mother, because I really understand what they're going through. In my role as a bereavement midwife, our role is really to advocate for the women in terms of the choices that they want to happen moving forward once they've received the news that their baby has died. We talk to them about induction process because they may not know what's going to happen. We guide them through funeral, post-mortem choices. But my job really is, I always call myself like, I'm the coordinator of everything that's going to happen moving forward. If you need anything at all, let me be that person. So if she has an issue with her job, for example, and she needs time off, I will help them with that. And so I guess I do the role because it's a way for me to give back. It's a way for me to make something positive out of Jada's death. I feel that I bring something that the women and the families appreciate because I can truly understand what they're going through. I would love to do more for the education side, but I think I'm so busy in my role that it's a tricky one, because I want to be able to share this and get the next generation and get that awareness and that education for everybody and all the midwives coming into it. So maybe if there's anybody out there who would like to do something to help me with that, I'd bite your arm off, because I think it's so important. I think that we talk a lot about standards for bereavement care and we only get one chance to get it right, but actually where's the investment in education for our midwives if a lot of people are only getting one session in their second year? That isn't really balancing with what you're saying in terms of the importance of bereavement care. And I think if the government is serious about wanting to improve standards, they need to kind of put their money where their mouth is and invest in education, because really I'm not in the business of setting anybody up to fail. I want everybody to come in feeling fully equipped. And if we're saying that that's how important it is, then we need to really focus on bringing people into the role and giving them that good support and foundation to be able to give good care to people. I guess I don't know what the next steps are for me. I feel like I just want to be a bereavement midwife forever now. As Sue said, I did go off. I did go into the senior management world. I had a lot of experience, obviously, in management and governance when I worked in elderly care, which I brought to the table being a midwife. And I think sometimes people say, oh, she's climbing up the ladder. And that wasn't it for me. I had the skill set to be able to do the job. And that's as simply as I can put it. But actually, I've realized this year I had to take some time off to have knee surgery. And none of us ever really get to have time off work. But it really made me stop and think. I stepped off the hamster wheel and I said, actually, what is important to me? What's going to make me happy? And maybe Mia leaving was a catalyst for that as well, because now I'm not just the mum that I've always been. I've now got time to think about what do I need now. And I thought, what was the happiest time that I've been as a midwife? And that was being a bereavement midwife. And so I stepped down from the Band 8 role this year. And everybody's saying, you're giving up your Band 8. And it's not about the banding, it's about my mental health and where do I feel like I'm best placed? Where can I give the most? And where do I feel I can make the most difference? And that might be to the 250 women I can look after rather than the thousands, because I've written a new guideline. I just felt like this is more important to me. This is what means something to me. And so I came back to bereavement, and I don't think I'm ever going to leave now. Somebody said to me, the consultant that looks after me, actually, I bumped into her and she said, I just think you should become a consultant midwife next. And I was like, no, I just want to stay in my lane and do my thing. And yeah, this is where I'm good. This is where I feel I make the most difference.